there is, some things that experts across the spectrum do like in the new recommendations, like a focus on whole foods. You see in that kind of inverted pyramid, you see the fruits and vegetables up there. But then there's also, like you said, kind of more controversy around some of these specific things that are being promoted. For example, changing recommendations around alcohol consumption. I think, Dr. Oz praised alcohol as a social lubricant and kind of like, should we really be rolling those back? A kind of odd focus on beef tallow as like a fat when there just like, again, does not seem to be a ton of nutritional value there. It feels similar to the vaccine changes, where it's a very big change very quickly that kind of goes away from these recommendations that were developed over years and years under, the guidance of large expert bodies.
That's Sarah Kliff, healthcare journalist for the New York Times. I wanted to talk to Sarah about the flurry of health news that's come out in 2026, from new U.S. vaccine recommendations and food guidelines to GLP-1 developments and OpenAI's launch of HealthGPT. As Sarah explains, these are shifts that affect each of us personally and nearly all businesses, whether you're directly in healthcare or in adjacent areas. So let's get to it. I'm Bob Safian, and this is Rapid Response. I'm Bob Safian. I'm here with Sarah Kliff, award-winning healthcare reporter at the New York Times. Sarah, thanks for being here.
Yeah, thank you for having me.
This new year has already brought a wave of new healthcare developments. I'm eager to get your insights and perspectives about it. Let's start with RFK Jr., U.S. Secretary of Health and Human Services, and the drop in recommended childhood vaccines from 17 to 11. You have some medical experts fuming. You have like Maha World pointing to examples of other places like Denmark that have even fewer vaccines. What's going on with this?
Yeah, it was a kind of a big welcome back to the new year with a giant news story. I think it's going to be a lot of confusion for parents, for providers. You now essentially have these competing vaccine schedules, and there's going to be a lot of confusion about which ones to follow, and a lot of concern from public health experts about eliminating this set of 6 vaccines from the official schedule. And I should say they're not fully eliminated. There is a recommendation, for certain groups, high-risk groups, otherwise talk to your doctor. And it is ultimately the states who are setting vaccine policy through mandates for what vaccines you need to enter schools. So it's just a lot of chaos and confusion, which I think we keep getting more and more used to every day in our healthcare system.
And this analogy to Denmark, like what Denmark does only 10 in their recommendations, right?
Yeah, I mean, each country kind of develops their vaccine schedule to fit that country's needs. Denmark is a pretty different place from the United States, with the universal healthcare system. Like, that is not the American healthcare system. Vaccines play a bit of a different role here because we have much less access to healthcare than most countries like Denmark. And so prevention is often our best step in, making sure, since we are less good at getting people the treatment they need for some serious diseases, starting at the beginning with vaccines can often be a really powerful tool. And it's kind of hard to transplant one set of recommendations from a small country into ours with, again, like a very, very different healthcare system.
This vaccine sort of debate, I guess, that has emerged, is it about sort of control over your own body versus like collective good, individual health versus community health? I have trouble understanding where all this comes from and why it's so whipped up right now.
Probably a lot of it grows out of, very negative experiences that people have with our healthcare system. There's a lot of things our system gets right, but also, I think a lot of people walk away from it feeling like it's incredibly expensive, which is kind of a lot of the work that I do focuses on that. They feel that their concerns weren't met. They're getting rushed through these appointments. They're not getting good explanations. And I think a lot of that kind of sets the groundwork for this movement that really begins to start to question everything that's happening in the doctor's office and whether it's working for them.
Let's move to another change from RFK Jr., the updated diet recommendations, this sort of hostility to ultra-processed foods, and then an embrace of red meat and saturated
Yes.
fats. I was talking with my wife about this, and she was absolutely flummoxed. She's like, "What
Mhm.
is going on? Aren't red meat and saturated fats drivers of cardiovascular disease? Like, what what
Mhm.
what are we doing here?"
We're flipping the pyramid, is it was what it seems like we are doing. Um, and there is, some things that experts across the spectrum do like in the new recommendations, like a focus on whole foods. You see in that kind of inverted pyramid. Do you see the fruits and vegetables up there? I think that's something that across the board like does draw support. But then there's also, like you said, kind of more controversy around some of these specific things that are being promoted. For example, changing recommendations around alcohol consumption. I think, Dr. Oz praised alcohol as a social lubricant and kind of like, should we really be rolling those back? A kind of odd focus on beef tallow as like a fat when there just like, again, does not seem to be a ton of nutritional value there. Feels similar to the vaccine changes, where it was a very big change very quickly that kind of goes away from these recommendations that were developed over years and years under, the guidance of large expert bodies.
Alcohol consumption was changed from no more than 1 to 2 drinks a day to something much more ambiguous, like limit consumption. I mean, is there science behind that? I know there are different studies that come out different times and say, oh, having a glass of wine is good for you, and then it says having a glass of wine is not good for you. And
Yeah, I mean, I think it's kind of good coming from this movement of you can make some better decisions for yourself than the government can. And kind of, we're going to give you the reins to this. And if you're thinking about getting the flu vaccine, we're not going to recommend it for everyone. You should have that conversation with your doctor. You should be making more of these decisions. We're going to put this more in the hands of patients. And I understand like why that ethos is kind of can feel empowering, but it also does have the risks with things like alcohol, things like vaccines. There are
mm,
knock-on effects to everyone else. These decisions that an individual makes are not just decisions that affect them. They're decisions that affect all of us. I think you can see that clearly with vaccines, with, the measles outbreaks we're seeing become more and more common in the United States. We don't live in a bubble. Our decisions affect others.
this sort of government guidance, diet, alcohol, even vaccines, like, do people actually listen? Like,
Yeah, there's no, obviously there's no binding law that you have to stick to the government mandated number of drinks. I will admit to going above those time to time. But they matter. They filter out to public health agencies. The vaccines that are recommended often become the basis for the vaccines that states require for kids to enter school. I don't think many of us are perfect about following the food pyramid, but we hear it and it sets some kind of standard for what we consider healthy. So you're right. They're not, hard and fast. Everyone has to be, cooking with beef tallow now, but they do kind of percolate out there and kind of set the groundwork for how we approach, health decisions.
mm, a conspiracy theorist, and there are many these days, might look at some of these changes and say, "Oh, this change in the recommendations, like I see the influence of the meat industry, the dairy industry, the alcohol industry."
I think with any sort of decision, you always wonder about the influence of industry on them. There have been some reports of folks with financial ties to the beef industry being involved in some of the bodies that help set these new nutrition recommendations. But I think you also just look at the leadership of HHS and you look at RFK as a guy who believes in a lot of this. So it does not seem like he needed a lot of pushing from the industry to come to these
Mm.
conclusions. So I think it feels like more than a conspiracy. It's a little more out in the open.
President Trump has said publicly that he doesn't find healthcare particularly interesting. So
Yeah.
does that mean that RFK has more freedom than health secretaries in the past? Has more license?
I think so. And I think it's because, RFK brought with him a whole movement and a movement that really believes in the things that he is doing over at HHS. So I think he has been given quite wide discretion to be. There is this part of HHS, it used to be pretty easy for our newsroom to cover. These things were kind of on autopilot. You had the guideline updates. They were not big, top of our website news for us. And now it's, hugely different than the role of the previous HHS secretaries I've covered. Things are getting changed constantly. And I think that does speak to the freedom that Trump has given RFK to really kind of roll with the things that he wants to do.
Hmm. All right, let's go to GLP-1s. 1 in 8 Americans have already tried them. Now there's a new pill forms that are coming out, which seems poised to swell those numbers even more. Is that good that this is like a miracle treatment, science-based, safe, effective?
We think so. I mean, it seems almost, in a way too good to be true, but we're seeing a lot of really positive impacts of these drugs. I think we're still seeing the long-term effects, but the impact they have on obesity and other conditions is pretty remarkable. I mean, at this point, it's becoming a financial test. And you see the Trump administration trying to respond to that by making some of these deals with makers of Ozempic, other drug makers, to lower the price of these drugs. So I think it's kind of long term. How are we, if 1 in 8, even higher numbers are going to be on these, how are we going to pay for it? But the health outcomes seem pretty clearly so far, quite positive for folks who are taking them.
And the indications are like this isn't just something you take for a stint. It's right because you'll regain weight and everything, right?
And that feels like something we're going to have to grapple with as we go forward. That these are not, right, something you take for a little bit. What does that look like? What does it look like decades of use of these drugs? And we don't know the answer to those questions. Those type of studies are ongoing, but I think it really has a force. It's going to be a driving force, both of, healthcare outcomes, healthcare spending, that is going to be shaping our healthcare system over the decades to come.
Or I'm not going to have GLP-1s in my water like fluoride because everybody needs it, right? No, because then all the restaurants would be upset because I'd stop eating everything. GLP-1s, can we tell yet whether it's sort of, it's a net savings because there's less treatment, or is the net cost because we have to be paying for these things?
I think for the next few years, at least, it's definitely net cost. These drugs are expensive. A lot of people are taking them. The type of conditions that you're going to prevent, diabetes, heart disease, those dividends are going to pay years and years and years in the future. A lot of those savings might accrue to Medicare when people are older, after 65, while the drugs are paid for by the private insurance system or Medicaid. So it gets like a little difficult trying to work out the math. But I'd say for the when I think 5-10 years, that these are definitely a really significant cost to the healthcare system. They are not going to be a saver quite yet.
These changes in the last few weeks, and I know this is an impossible question to answer, but I sort of wonder, like, are these good changes?
Oh gosh, I don't know. It feels like there's so many changes because we haven't even got into like all the coverage changes that are going to really reshape our insurance markets over the next few years or so. So yeah, I mean the GLP-1s have been like in a very positive development. With the guidelines, that feels a little more mixed bag. And I think if you were to ask, are we moving in the right direction with vaccines? A lot of public health experts would come back and say, no, that this new vaccine schedule is not moving us in the right direction.
You mentioned the coverage changes. The government shutdown last fall was in part about healthcare costs and coverage changes. What's the impact been so far? What do you think is where we heading?
Yeah. So we have big changes to 2 of the major healthcare programs that cover people. One is Obamacare, the Affordable Care Act, where that shutdown that you mentioned, Bob, was over whether to extend these kind of higher subsidies for the 20 million or so people who buy coverage on that marketplace. And that's what Democrats were trying to demand, but ultimately were not able to get that demand. We just got new Obamacare numbers yesterday that showed that signups are 1.4 million lower than they were last year. So that's 1.4 million people who probably took a look at the prices without these extra funds and said, no thanks, I'm going to go uninsured. Those are preliminary numbers. We'll probably get a more final estimate later this year. So that's one of the big changes happening right now. And then there's Medicaid, which was cut by about 900 million billion, getting my scales wrong, in the big Republican bill that passed last year. And those changes are on the horizon for next year. And those are probably going to amount to even more significant coverage loss. So we're seeing this really, kind of unprecedented in the 15 years that I've covered our health care system, this really unprecedented rollback of the federal health insurance programs that is going to have all sorts of knock-on effects. Democrats will absolutely want this to be a campaign issue in the midterms, and I think that's especially true for the Obamacare subsidies that did not get extended and that you've seen Republicans kind of flirting with extending. They're keeping these proposals that can't quite pass, but that do garner some Republican support to bring that money back, because we do know from some of the data we've looked at, a lot of these cuts to Obamacare actually hit Republican districts the hardest. With the Medicaid changes, they held off the biggest changes until January 2027, so to get right past the midterms. So those will be on the horizon when voters go to the polls in November, but they will not be, actually
You won't be feeling
implemented.
it yet.
You won't be
Yeah.
feeling it quite yet, but I think you'll absolutely hear, Democrats talking about those.
Drug prices. I know the government's poised to launch TrumpRx.com
Yes.
this year. So how will it work?
So the idea of TrumpRx is to let people purchase drugs directly from these manufacturers. Either you're uninsured, your insurance isn't getting you a great deal, maybe you have a really high deductible. The Trump administration has negotiated specific prices that people will pay if they just buy directly through this website for a handful of commonly used drugs. They've done this for some infertility drugs that are used for IVF treatment that can be pretty expensive. And I think the impact of that, remains to be seen. As again, my colleague Rebecca Robbins has reported there's a drug that a 3-month course to cure hepatitis C on TrumpRx, the negotiated rate is going to be north of like $2,000 a month. I'm curious to see what happens with it. And in terms of why the drug makers are going along with it, I think they want to avoid more regulation. They want to avoid kind of more aggressive efforts. I think the calculation that a lot of them have made is that let's get the negotiated rates for this specific set of drugs. A lot of them also, importantly, are about to have their patents expire. So they were going to face generic competition in the relatively soon future anyways. So I think the idea is, okay, let's, do the negotiated rates for these and avoid like a more sweeping overhaul of how drug pricing works in the United States. I'm curious to see who this helps. Does this matter that much? It seems different than what we've tried before. No one has wanted to take like a giant whack at the apple of like completely regulating drug prices, which is how all our peers abroad do it. So this feels like, a smaller version of that. You had mentioned healthcare has not traditionally been a focus of President Trump's, but drug pricing seems to be one that kind of has stuck with him. I remember him talking about in the first campaign, and specifically this idea that other countries are getting better deals than us, I think has really driven a lot of this. Like, I want the same deals as those countries. And that is essentially the prices on TrumpRx are supposed to be mirroring like the prices other wealthy countries are getting from these drug makers.
It's so interesting to try to get my mind around sort of this administration and Trump and which areas, we're supposed to have freedom and agency and license for ourselves as individuals, and which areas, that he and the government want to step in and sort of strong arm people into doing things their way. Yeah.
Right, this it almost like closes the circle between left and right, because like you see Bernie Sanders, has talked about taking seniors to Canada to get the drug prices that Canada has. And so there are some kind of weird alignments with kind of traditionally liberal thinking on drug policy. I haven't seen Democrats speaking out in favor of TrumpRx, but it does kind of take a tiny step towards kind of price regulation and the government stepping in terms of setting the prices that we pay for healthcare.
Other news this month, OpenAI launched GPT Health, this AI tool for users to consolidate their medical records. People have already been turning to AI models for medical information, even doctors sometimes using them as a backstop. OpenAI specializing its health offering. Is this Is this good? Is this bad? It's just inevitable.
I think inevitable. That feels like the right adjective to use here. But it's been something I feel like so many tech companies have tried to do some version of this. There's always been this idea that patients should have better access to their medical records. And instead, if your experience is anything like mine, you have 8 different portals to log into with like records scattered across them that are unintelligible to you as, a normal human being. And there have been various companies, Google kind of stands out to me as one of them, that have tried to, say, we're going to make your records consumer accessible. We're going to make it easy for you to understand, that just have not been able to do it. Information sharing in healthcare is terrible. I wrote a story that's always stuck in my head about how the fax machine is like, it is the only industry where the fax machine is like a dominant way of sharing information. And I think I wrote
Yes.
that in 2019, and I think it is still true today. It's still an industry that is shockingly paper and like CD based when you get scans. And, and I think a lot of that, in my view, like traces back to a lot of the financial incentives of our very fragmented healthcare system. Systems don't want to share information. If hospital A holds onto your information, it makes it harder for you to be a patient at hospital B. So their incentives are to, keep it to the fax machines, not have that easy share of information. Um, in terms of is this good, is this bad? I don't know yet. I think a lot of people are attracted to the idea of having, AI be able to make their health records more accessible, more readable. You already have a lot of people turning to AI. I think it's interesting, and it's something I want to watch.
I mean, my colleague Reid Hoffman talks all the time. Is very committed that AI and tech offers this tremendous potential to improve healthcare and access to healthcare, particularly for folks who don't have it. And I'm always poking it, but aren't there risks about misinformation and like how is that trade-off?
Yeah, right. No, and I think that's a great trade-off to think about because you're completely right. There are all these areas of the country, and even there where it's difficult to find a doctor, or even in like a large metropolitan area like Washington D.C., where I live, where it's very hard to find a good primary care provider. And you think of, is there like a liberalization of health information with AI and being able to use those kind of tools? But exactly, you worry about misinformation, hallucinations AI can have. And then you think of that in healthcare, a really sensitive area. I'm also interested in how it's going to shape the medical system. There is so much paper in the medical system. There are so many records and transcribing, and you're starting to see all these AI tools come into play there. It's starting to play a major role in insurance denials and then appeals of insurance denials.
I've heard that physicians' offices and hospitals, some of them are using AI to sort of game the system, or as they would put it, to optimize their billing practices, right? Like using AI to identify billing codes that can be applied to doctor visits and increasing the volumes of claims. And, and on the other side, you've got insurers using AI as a way to like deny claims, right?
And this is the war they've been in for decades. It's just a new tool, a new weapon that each of them has in this fight over, I want to bill for this. I don't want to pay for this. And now the arms race just kind of keeps continuing. And maybe it doesn't solve the administrative cost problem. I mean, maybe it's worse because now everyone has this new powerful tool on their side. And then I'm certain there are all sorts of vendors who have dollar signs in their eyes, saying they are going to make the latest and greatest AI tool and sell it to the insurers or the hospitals. And then all those costs trickle down to us as healthcare consumers.
We only have a few more minutes, so I'd love to try a rapid fire round, pose some topics, and you give me a quick reaction. That's okay? So we've talked largely about federal guidelines and policies. Are there local or state policy health trends that we should have on our radar?
I think one that is on my radar, it's health adjacent, I would say, is this proposed tax on billionaires in California that is partially motivated to offset the big Medicaid cuts that are coming. It's becoming a big issue out there. I'm curious to see if other liberal states, I mean, they don't have quite as many billionaires as California to chase after, but if they are looking at some kind of taxes like that as they're facing down these really steep Medicaid cuts coming their way.
You mentioned IVF in passing before. IVF as a tool to raise the U.S. birth rate. I mean, Vice President Vance, other MAGA folks are pushing for employer insurance coverage for IVF. We've seen anti-IVF efforts from other Republicans. Is IVF about to have like another moment?
To be determined. It definitely kind of roared into the political scene after the big in Alabama when they very briefly, gosh, that feels like a decade ago, and I think it was 2 years ago, when they briefly outlawed IVF, and since then has been again become like a pet issue of President Trump's. He's quite supportive. He has claimed he is going to, increase coverage for IVF. So far, the actual action we've seen are the adding of the infertility drugs to Trump RX. We'll see if there's more. If there were to be some kind of mandate that ensures cover IVF, that would require new legislation. And we have not seen that gaining significant traction here in DC yet.
All right. C-section births, 1 in 3 births in the U.S. are C-sections. You've written that this is often due to unreliable technology. Can you explain that?
Yeah, these are a set of stories I did last year that focus on electronic fetal monitoring, which if anyone's had a baby, it's those two kind of bands they put on your stomach that kind of create this wiggly line that shows your baby's heart rate. The idea of fetal monitoring, when it was developed in the 1970s, was that it would give doctors this reliable tool to kind of peer inside the body, figure out when the baby's in distress. In actuality, study after study shows it is not a reliable indicator of fetal distress, and doctors often overreact to the readings they see, jump to a C-section when nothing's actually wrong. So it is one of the kind of key drivers of overuse of C-section in the United States. And despite that, just remains ubiquitous in American obstetrics. Pretty much every patient who delivers, more than 95% will use this technology that, one leading obstetrician told us was the worst test in medicine. The alternative is the older technology, which is checking every now and then with a stethoscope. And because you're checking less, you're less likely to pick up these false positive signs of distress. The government actually, a little bit after those stories ran through ARPA-H, which is the kind of technology investment arm that looks at kind of new kind of moonshot technology ideas, launched a project to reinvent the fetal monitor. So they are working on that effort. We'll see what happens with it. But I think there is an acknowledgement from the government, at least, that something needs to change in this space.
All right. Finally, given that our audience is business leaders, for employers that want to reduce their health cost burden without just shifting it to their employees, is there anything they can do? Do you have any advice about how you navigate that?
A lot of this is out of their hands. A lot of times they're handing over the reins to an insurance broker, especially if you're not a giant employer. Your leverage when you have these giant and growing insurers and hospitals is not especially high. But if you're an employer who really wants to get on the weeds on this, one thing that has changed over the past, 5-ish years is a big increase in price transparency. So there are rules that have passed through both the Biden and Trump administrations requiring both hospitals and insurers to make their prices public. The files are big and cumbersome, but if you look through them, you can actually see how much your local hospitals are charging for every C-section, knee replacement, urine test, everything. So if you really do want to dig into your healthcare costs, and I have talked to some employers who have done this, you can see, if hospital A is charging 5 times as much as hospital B down the street, which is something that absolutely happens in our healthcare system for really basic procedures like an X-ray or a CT scan. And that might be one way you could get a better handle on kind of, is there a place where you're spending, outrageous amounts on some pretty basic care?
And then you could adjust the insurance or the coverage that you offer to to
Yeah, I
limit
mean, so
those
that's
costs.
the right. So, I mean, it's a multi-part slog, I would describe it as. But then, one thing you could do is try and like work on your insurance design if there is a high quality center that is, offering x-rays at 1/5 the price of another, you can try and use, cost sharing, different financial incentives, networks to kind of guide your employees to the one that's, going to save you a decent amount of money.
Man, nothing is simple about this, is
No,
it?
no.
Nothing is simple about it.
We're just at the verge of like a really big cut to federal healthcare programs and therefore just a cut to the healthcare system, which is nearly, $1 trillion in cuts over the next decade. And we have not done that ever. So and I don't know, it's unpredictable like what this is going to look like. We know it's going to look like people losing insurance. What does it look like for the hospitals? Are we going to see a wave of hospital closures? That ripples out to not just people who have Medicaid and Obamacare. It ripples out to everybody who uses that hospital if they shut down the service lines that are less profitable, like emergency care or obstetrics. A lot of these cuts take place in 2027. That either means finding the money somewhere elsewhere or cutting the services that are received. And that's a really difficult trade-off that doesn't seem to have, a great end to it.
Hmm. Well, Sarah, that cautionary
happy ending.
and bracing note, thanks so much for doing this. I really appreciate it.
Yeah, thank you for having me.
I'm not sure Sarah wanted to end on such a bracing note, but when changes come so fast and unexpectedly, it does tend to breed caution. The U.S. healthcare system is such a muddle. No one would design a system like this if starting from scratch, but of course we don't have the luxury of starting from scratch. As Sarah points out, the size of the U.S. makes all choices and all changes more complicated. So how do I turn this in a more optimistic direction? I'm impressed by the number of times Sarah was prepared to say that she didn't know what would come next. That takes bravery and maturity. The fact that the future is unwritten leaves the door open for us to iterate on our choices to land better outcomes in healthcare and elsewhere. To achieve progress, we have to be willing to break with tradition. I can applaud RFK Jr. for that spirit. At the same time, I remain hopeful that he and other leaders won't be swayed by personal emotion or frustration into abandoning or ignoring scientific evidence. Personally, I'm not going to start relying on beef tallow or amping up my alcohol consumption. I'm going to keep getting my annual flu vaccine. Most of all, I'm going to continue to dedicate myself to learning more about what's new, what's to be trusted, and what best supports a healthy human community. I'm Bob Safian. Thanks for listening.